do I just start it? So like, Dr. Eidson, you should know me by now. I'm Dr. Eidson. We have a case of some corneal ulcers coming through. So a corneal ulcer, the cornea is one of the more superficial layers of the eye. So typically happens from trauma. So a dog scratches their eye or runs into something and causes some sort of trauma. There are some diseases like dry eye, has a much longer name. KCS is the shorter one. And so with dry eye, they are producing tears. And so it makes that cornea a little more susceptible to some sort of damage. In Jacques' case, he does not have dry eye, but he did have a trauma incident. So when you suspect a corneal ulcer, typically dogs are very squinty, can't really touch it. They may have some drainage, may not, but usually the most common thing is they're just keeping that eye shut. And so when you see this corneal ulcer, the first thing that we're typically gonna do is use this stain. So this is fluorescein stain, and it is a lipophobic, which means it hates fat, and hydrophilic, which means it loves water, substance. So when you put it on a cornea with no abrasion, it just comes right off because it doesn't like the fat that sits on top of the eyelid or on top of the eye. So once you remove that with an ulcer and you can get deeper into the cornea, you now have an area with no fat and water. So since this loves water, it picks up that stain, and that's how we can see a corneal ulcer. And so then we use this fancy little black light, and that will help glow. So like in Jacques' case, you can see we stain it. He's got a very large ulcer that we show with the black light, and all that area that glows is the damage to the cornea. Sometimes it's small and sometimes it's bigger, like in his case. And what specifically causes it, we don't know. Jacques, we think he ran into a earpiece of glasses that caused the damage.